I'm Dr. WAHEED, working on clinical research on vitiligo in Central Research Institute of Unani Medicine, an apex research organization under Ministry of Ayush Government of India. Is a part of Central Council for Research in Unani Medicine. I'm doing research on vitiligo for over 30 years. It's as good as 3 decades. We have developed as good as 16 formulations in the management of vitiligo. As all of us know that vitiligo, being a dermatological problem, cosmetic problem, which is regarded as social stigma in our society. Since being a cosmetic problem, patients always have a mental stress, psychological psychological stress, which will lead to the social isolation. And being a social stigma attached to it, it's very difficult to get a matrimonial alliance to the affected person. It is not only to the affected person, but the entire family has a social problem, psychological problem, as the other siblings are also to get a matrimonial alliance in an Indian context. As a vitiligo, as all of us know, that is a white spots over the skin. Generally, all white spots are not one. It has a different types, and each and every type has its own cause, own somatic appearance, aggravation and regression pattern. While treating the vitiligo, it's very important to know the which type of vitiligo, and when treat, there are many factors comes during the course of treatment, like site of lesion rather than the extension of the lesion. As entire face, for example, I'll just give a very few examples, like entire face is depigmented or white, the lost its color. So may take approximately a year time to regain the repigmentation, whereas lips is a difficult portion. Now, when we talk about the doctor's perspective versus the patient's perspective, in the doctor's perspective, it is as good as 90% repigmentation is recovered, which is not a cosmetic problem no matter at all. When you see with the patient's perspective, could be a vitiligo 10% or 4% repaint over any part of the body or the exposed areas like lips. When you talk about the face part of the lip, then probably the social stigma attached is always there, and patient is stigmatized. When patient is stigmatized, probably he may lose the best treatment which he has to receive from the society, which will definitely affect in the broad of the patient. So coming to the different types of vitiligo, there are about 70% of the vitiligo patients develop their full vitiligo lesions before attaining a monarch, that is around 16, 17 years of life. And no age is, as it is, no age is exempted, but over 30% of the patient develop before attaining the early adult life, and over 50% develops before attaining the 3 decades of life. As all of know that vitiligo being a cosmetic problem, everybody's desire to get a back repigmentation, but various factors comes, like aggravation of the vitiligo, when vitiligo is very acute. Since it is because of the autoimmunity, the very peculiar mechanism which is attached with the vitiligo, autoimmunity is periods of stability followed by aggravation. So when the vitiligo is stable and repigmenting is always good, when it's become active, there is a thrust area is that there is a good need to develop a formulation to make it stable. The definition of the stable vitiligo is neither patient is acquiring the new lesions, nor the existing lesions are increasing in size. So once we are making it stable, then there are two benefits. One is the repigmentation, whatever is achieved may retain permanently, and secondly, if there is some repigmentation which is not happening, then probably a number of surgical interventions are available, so an integrated approach can be taken. So in a nutshell, when we talk about the vitiligo management, is a great need that total vitiligo solutions under one roof, an integrated approach. Then coming to the type of vitiligo, the 70% of the vitiligo among the vitiligo patients are non-dermatomal vitiligo. Generally, is an extensive type of vitiligo. It affects the major part of the body, that is two-thirds of the body, entire face, scalp, trunk, both the limbs are affected. And whereas segmental vitiligo is always unilateral type of vitiligo, you must have seen one side of the cheek is white and half of the lips and half of the nose are lost is pigmentation. That is a segmental vitiligo. It affects only the area supplied by a nerve. Since it affects the area supplied nerve, it is always unilateral. It is always localized vitiligo, but it is considered to be very resistant to treat. Whereas non-dermatomal vitiligo, though it is extensive and rapidly expressing, and a major part of the body gets the depigmentation, but it is the initiation of the repigmentation is very rapid in the non-dermatomal vitiligo. Another type of vitiligo is a acrofacial vitiligo, which affects the lips and the peripheral areas like fingertips and toes, feet, palm, etc. So these are considered to be more challenging to the doctor because these are all the areas are regarded as a resistant areas. In this type of cases, the aim of treatment is control the further spreading to get back the repigmentation. Of course, to get back the repigmentation is always slow. So in that case, once it becomes stable, then a number of surgical procedures can be applied and that can be taken out very easily. So vitiligo management needs the critical opportunity to initiation of the early treatment is to control the further spreading. In other words, to make it stable, to regain the repigmentation or induce the repigmentation and accelerate the repigmentation, and of course, need is to regain the cosmetically acceptable repigmentation. Another type of vitiligo is a mucosal vitiligo. It affects only the mucous membrane like lips and other body orifices, around the body orifices. So this is one of the most difficult to treat. But since from the Central Research Institute of Unani Medicine, which is an apex organization which is doing research for the last over 3 decades, we have developed very safe and effective formulation, as good as 5 to 6 through CCREM. We have applied for patents. In addition to that, we have upgraded our research platform for creating the evidence-based data. In terms of preclinical safety, we have a pharmacology lab where entire safety studies can be done. We have a preclinical in vitro cell culture facilities where in the pigment cell, that is melanocytes, we maintain, and we are doing a number of studies with the different drugs in terms of safety and efficacy into different concentration. We have a molecular biology lab and a biochemistry lab and a pathology lab, well supported to the clinical department. We have an expertise in phase-to-phase studies. We have initiated multi-centric studies across the India under the banner of CCREM. So all these studies has the ICMR registry, which is mandatory now. In order to create the long-term safety data, we have done genotoxicity studies with collaboration of the Department of Genetics, Usmania University, which is located in Hyderabad. So overall, we have 80% success rate in vitiligo management, and both to control the further spreading, to retain the repigmentation which we got in order to minimize the chances of relapse. So that is nothing but the cosmetically acceptable repigmentation, which is a great service. Even if one in a younger age, like a female child in our India, is which is denied of the spinsterhood, is denied of the maternal allies, is a question of social security. So is a social service. As far as treatment concerned, we have both topical and systemic drug. Topical application medicines are to be applied over the depigmented areas or whitish areas, and followed by exposure to the sunlight for around 10 to 15 minutes, and to back in the home and keep it for 1 hour and wash it off. Sensitivity is a big challenge among the vitiligo patients. Sometimes we will have a sensitivity problem. In that case, the exposure time, sensitivity cannot be altered because it is genetically predisposed. So we need to alter the concentration of drug, frequency of application, and exposure time. And we have oral formulations, both to control the further spreading and to get back the repigmentation. Psoriasis is another condition which is also autoimmune disease, in which the extra granulation of the tissue, extra formation of the tissue which takes place leads to the psoriatic plaques. It alters the quality of life of the patient. There's a lot of itching and burning sensation which leads to the secondary infection, which makes the patient to have a more seek the more frequent medical advice, and will end up with the social and cosmetic burden, and as well the economical burden. When the patient has the psoriasis, especially in the extensive cases, when there is a lot of itching and burning, which leads to secondary infection, will be bedridden for some time. So they lose the walking hours. Probably that will end up with their economical burden. So there are many types of psoriasis. Few it affects the bony prominences, so it affects the pressure points. Few affects the peripheral areas and angular areas and the armpits, and some affects the face and the nails also. One of the complications which is more common, being a stubborn disease, when it runs for a longer time, it may lead into psoriatic arthritis. Arthritis is another condition which causes the joint pain and degeneration of the cartilage. So Unani system of medicine has very good drugs to control this autoimmune process, to control the further spreading, and to control the itching and burning, which has got the topical application drug has very good soothing effect. which controls the itching and burning sensation, so which translate into the improvement of the quality of life of the patients, quality of life of patients. Even we have a oral formulation of formal drugs, some of the drugs in the form of muscle and muscle drugs, some of the drugs as a blood purifying agent, some of the drugs as the immunomodulators drug. So these are the drugs which can control the further tendency of the psoriasis in the body and control the further aggravation of the psoriasis. So psoriatic treatment, when you compare with the treatment, duration of the treatment, psoriatic treatment lasts maybe probably 2 to 3 months, whereas vitiligo treatment is a prolonged treatment which need to be taken for at least a year or over that. As all of us know, vitiligo being a very stubborn disease, there is no successful treatment across the nations, across the systems which is practiced across the world. In modern medicine, when disease is very active and rapidly spreading, probably health of the steroids again, which is not radical treatment for vitiligo, but to suppress the automatic mechanism, temporary, the help of the steroid taken. Steroids have a lot of adverse effect as well. As a withdrawal effect, it bounce back. The vitiligo becomes more active, which we have noticed in patients come across during the course of treatment. In addition to that, the certain group of drugs which are available in the market in allopathic system for longer time, it's very difficult to take, as is a hepatotoxic. So vitiligo drugs which we have developed are safe and effective in animal medicine. And in same thing in the cases of psoriasis. The help of the steroids are being taken with the modern medicine people or dermatologists to aggravate the problem. Probably there is not the radical treatment for it. So the safe and effective treatment is the need of the hour, which through the Unani platform we have developed, and which is one of the best proof to it is treatment in relation to the systems across this, which are being practiced across the nation.